Welcome to the 289th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome, and thanks for listening. Well, training's going good for a change. Building up my mileage, continuing. I'm on officially week 8 of my weight training process, and that's getting good. I'm lifting more weight, feeling stronger, seeing it in my running, recovering. Is my ankle completely recovered? No, but it's pretty much there. Again, endurance is still working up. If I do too much on one day, feel the residual a little bit the next day, but for the most part, it's getting better. I have little doubt that I will not make the start line November the 2nd at the Rattler, so that's a go. We're actually going to go to the long haul course September 21st and do one of the loops. If you remember right, the 100-mile course was 6 16.8-mile loops, so we'll at least do one loop to go back to the scene of the injury. So I'm looking forward to hitting the trail and, again, putting my ankle in some more difficult situations to kind of gradually get back into the trail work. So all is well there. In the office today, my lecture for our practice was on hypertension, the etiologies of hypertension, as well as potential treatments, both medically and non-medically, and how the allopathic or traditional medical world really regards hypertension as being essential. So if you were to go out to dinner to a restaurant like the Outback or Olive Garden or one of those restaurants, and you took a poll of everybody over 50 in the room, how many people were on blood pressure medicines, I think it would be astonishingly high. If you asked the same room how many people were ever taken off of their blood pressure medicines, you would find it astonishingly low. Which is very unfortunate because most blood pressure issues can be treated effectively to allow people to get off of their medications. Most people agree that increased sodium intake, especially in the standard American diet, is associated with increased blood pressure because your kidneys have to regulate the thickness of your blood, so the more salt you take in, the more water you need to dilute it out, and it then ends up causing pressure in the arteries. But one of the things that people don't address is that of the sympathetic tone or the autonomic nervous system, the fight or flight mechanism, versus the parasympathetic tone, more of the vagal system or activation of the phrenic nerve. Most of that actually has to deal with life circumstances, and one of them, of course, is stress. And stress is very different to different people. How people react to it is different. One person's stress is certainly not another person's stress. I've had people tell me working in places where I thought was very little stress was very stressful to them. Some places, some people, the stress of any little thing can trigger a blood pressure to be very elevated. Some people have stress and their blood pressure is not elevated for the most part. So there is a variation, but for the most part, stress is usually tied to some sort of life event that we react to, and it's how we react to it is basically our perception of the event and what the actual event is. Sometimes there's an event, but we then move it forward and project it into the future and how it's going to relate to future events, and things snowball out of control. I had Jill Bolte-Taylor on the podcast probably a year or so ago, and she talked about how we have this moment of reaction to an event. It's about 90 seconds where, you may have an adrenaline rush, your heart rate may go up, your blood pressure could transiently go up, your perception of danger increases, and then after that 90 seconds, the cortisol levels, the sympathy, adrenaline levels actually come down, and we have a choice at that point on how we're going to continue to react. Are we going to continue the dialogue forward, hang on to it, let it grow, and smolder into a full-bore event, or can you let it go or change your perception, or even take a moment to assess the facts and what is real and what is perhaps a perceived possibility in the future. Of course, in allopathic medicine, we really don't evaluate stress. We give it, everybody has stress. You can't get rid of it, which is true. And again, we can't really define it because it's different for different people. So we just go ahead and medicate it. And we medicate it in the form of a blood pressure medicine. So if the stress causes people's blood pressure to go up, then we just medicate it. We might not even choose the blood pressure medication according to the individual. The blood pressure medicine may be chosen more likely than not to a standard protocol that is written out. So whether you're 40 or 80, and whether you're having a stressful reaction to a life event that may pass or whatever, or you're a high salt eater or whatever your diet is, or your vascular consistence, the protocol usually calls for a certain staging of medications, perhaps a diuretic to start with, a beta blocker, and then progression to there and add on as you go, with little thought as to what the individual might benefit from. Of course, the other thing is anti-anxiety medications, where we try to dull one's senses and their perception of stress. We don't make their stress go away, but we make them not care. The unfortunate problem with that is that they're very addictive. They cause an upregulation of receptors. It makes it very difficult to get people off of them, and they are also associated with increased congestive heart failure in some instances, especially the benzodiazepams over time, especially if they're used for sleep. Again, it doesn't change the stress, it doesn't change the overall event or our ability to actually deal with that particular stress or future stresses. The other way people deal with stress is overeating or grabbing food to pacify. It's my only reward. It's the only thing that I get to have control over, perhaps, or other drugs or alcohol. Numbs, distracts, but does not fix the stressful situation or our ability to handle future similar stressful situations in the future. Most of the time, the individual that may be involved in causing the stressful situation don't even know that they caused a stressful situation. The person that cuts you off on the highway, or perhaps people that don't show up for work on time, or do their own, or don't show up at all, or don't do the right thing. They don't even know how much stress they've caused you, and yet we have a reaction to them that may drive our blood pressure. And when you kind of stop to think about it, it's a little bit silly, because all the getting worked up doesn't really do anything to change their behavior. It only makes our health worse. Easier said than done, however. I've had numerous people be very good at practicing yoga and even meditation to the point where they can take their blood pressure and it can be really, really good. But then life proceeds and their blood pressure goes back up. People can come out of a very peaceful religious service and everything be fine, and then something happened to the parking lot and it's all over, and they're back to their high sympathetic tone, high cortisol-driven lifestyle. The reality, there's not even going for a run. As much as it is a stress reducer for me, I can go for a run and my pagers start firing off during the run and my stress can go back up, and I, have to get a hold of myself and say, wait a minute, this doesn't have to direct my day, so to speak. So all of these things that control our blood pressure for little bits of a time are great, but we have to be vigilant during the rest of the day when these events come up, that kind of take the stop and pause to actually see how much we're hanging on, or what's our perception, what are really the facts, and what can we do about it, what control do we have, and let the other stuff kind of fall to the wayside. So the more that you can actually recognize I'm going down a path like this, then it becomes very silly, myself included, to hang on to the storyline and keep amping it up and telling it over and over again. So it's something we all can work on more. It has become easier for me in situations where I don't know people. As when I was younger, I probably was more upset when I was driving and people didn't do the right thing. I wouldn't call it full-blown road rage, but irritated by things that from people that I don't even know. Certainly not worth it. Whatever I do does not, it doesn't affect them one bit, doesn't help my situation, doesn't change them. It only affects me. So those become quicker, easier ways to practice that you can kind of let go of things that, people, you don't even know the person. There's no reason to hold a grudge or be angry. You'll never see him again. Practice on those first, and then you kind of increase your tolerance level, so to speak. And then you can increase your ability to perceive there's a stressful event and try to put that pause in there and assess the situation and then react accordingly. You might be surprised what it does for your blood pressure and your heart rate. There's a couple odd things I've heard this week. One was Ozempic butt. People are worried that they're losing weight and they're having a saggy butt, and what to do about it. I've had people come into the office who have lost weight and they're worried that their neck is getting saggy or their arms are getting saggy, and almost to the point where they don't want to lose any more weight because the skin is loose. I'll tell you, over time, it will tighten back up. And it's certainly not worth a surgery, which is often offered in the Ozempic crowd. So the first thing people do when they have a weight loss, and again, with Ozempic, you might have a little bit of an early weight loss and people get some flabby, they decide that they're going to start in with the plastic surgery to get things tucked away even more. All that bounces back. There's certainly a risk to plastic surgery, anesthesia, infection, and so forth. And it's just another way for the medical community to make money off of people that are trying to fix a problem very quickly. Of course, my friends, the carnivores, are always at it, and there's been some controversies where the carnivore people have been caught eating berries and caught eating the occasional birthday cake, and most are known to be have the cheat days. So even claiming to be 90% carnivore, they have to have the cheat day that takes them down to about 80% carnivore. But one of the things that does happen in this population is a massive increase in LDL, and it can be some really impressive LDLs into the 200 range. Normal LDL, you would like it to be less than 100. 70 or 80 puts you in the heart attack free zone, and it also matters a little bit about the circumstances around the LDL, but nevertheless, in the 200 is certainly something that you don't want, but there's been many justifications because they're so lean that they're breaking down LDL into their bloodstream, but nevertheless, it still causes a problem. Some people claim that the high LDL or the high cholesterol is needed for brain function. Our brain is full of fat and cholesterol is needed in those processes, and cholesterol is needed in cellular processes. Well, myelination of nerves is the highest in infants and young children less than a year of age, and certainly toddlers in the 30 to 40 range. And they're myelinating their nerves at a faster rate than any other time in life, yet their LDL is low. So if we're an adult in our 50s or 60s, I don't think that an LDL of 200 is a necessity to keep our brains alive, when it was doing just fine at very low levels, probably up through the 30s, before it started to overrun our system's ability to process and eliminate it. We certainly shouldn't see dementia increasing in populations that are actually having higher LDLs over time. So you wouldn't expect, if LDL was so protective, you wouldn't expect to see the dementia and the progression of dementia and Alzheimer's that we have in the population. Hunter-gatherers, especially ones that are still followed, have very low LDL and very little incidence of heart disease. I always like to look at, populations like the blue zones, the hunter-gatherers, people that are alive, living life, and have done well on a prolonged, in a prolonged particular lifestyle. People that exercise on a daily basis and move all their life tend to remain fit and mobile. People that never have tend to decline. You see it over time. It's an observation. It's one of my biggest reasons why I don't really get on the bandwagon of ever prescribing a new medication that hasn't shown the test of time, because often it is studied in a very controlled, drug company sponsored way that results in a positive effect, and then it gets on the market, and it rarely has the profound effects that it did in the trials, and the side effects start to come out. So I like to look at long-term evaluations of things over time, so population studies over time, people that have done well. And of course, there are outliers on both. Not everybody that smokes dies of lung cancer. Some people can smoke and live a fair amount of time. It's not really the norm. The other thing that has been shown with a carnivore diet is actually a decrease in testosterone, which is quite funny in some respects, because the carnivore people, there are the chest-thumping, manly men and muscular peoples that think that testosterone actually will go up with the consumption of animal products, but it actually tends to go down in multiple meta-analysis. If you look at the reason why is because of the ability to process the nitrogen associated with protein. So the maximal rate of urea synthesis is a very real phenomena in the human body that can be overwhelmed with an extremely high protein diet, meaning most of these studies were greater than 3.4 kilograms or 3.4 grams per kilogram per day in these individuals. And what happens is you can't convert and you can't deal with the ammonia, which can possibly build up. The other thing is that the nitrogen has to be converted to urea to make up for the amount of nitrogen that can't be used for the body, and the system, again, is overwhelmed. There's an increase in oxidation. So before I talked about, you like your LDL as low as you can, but if you eat plants and your LDL is still, creeping around 100, 120, it's not really near as bad as you're not having a high oxidative stress load, a high breakdown and development of free radicals associated with meat ingestion. And of course, we know there's increased inflammation with increased meat ingestion, increased animal protein ingestion. We select for a bacteria in the gut that increases the risk of inflammation in the body. So the increase of inflammation, oxidation, overwhelming our ability to synthesize urea results in overwhelming the liver and a decrease in testosterone in these people. So don't think that that's the way to increase testosterone if your testosterone levels are lowering. I would look more towards exercise, more to decreasing alcohol consumption, and decreasing inflammation to improve testosterone production. Another association was meat and diabetes. There was a meta-analysis with 1.97 million adults, 100,000 controls, 31 cohorts, 20 different countries, resulted in 1,966,444 people, 107,027 cases of diabetes during a 7 to 15 year follow-up. The more processed meat, the more unprocessed meat, poultry, all three were associated with an increased risk of diabetes the more you consumed per day. So again, increased saturated fat, blocks the uptake of glucose. Again, increased protein diet, increased meat diet is not associated with reversing or preventing diabetes. When I see people online showing how many eggs they ate in one day and how many steaks they ate in one day, the first thing that comes to my mind is, why must you eat so much? Why must you override your metabolic system to be able to process such things? If it were so nutrient dense, why couldn't you eat just a little 3 or 4 ounce piece of meat 3 times a day and call it? But people aren't doing that. They're eating these large portions that it basically overwhelming their ability to metabolize and increasing inflammation. People talk about we need fat. We need fat for our brain, good fat, bad fats, and most recently there's been argument of seed oils versus animal fats and why we should, or why, our health has declined since the use of vegetable oils and margarines, and we were much better with animal fat, beef tallow, bacon grease, and so forth. And I always giggle on that because I was raised in country cooking where there was a bacon grease on top of the stove and everything was cooked in that, and lard was used to make pie crust. And my relatives suffered from diabetes and heart disease at pretty young ages with the animal fat. So from a personal experience, certainly would be hard for me to justify that. That being said, because some of the seed oils and vegetable oils are processed, and how they're processed can be somewhat toxic, there is some concern. And oils that are rich in omega-6s are more pro-inflammatory than omega-3s. So a lot of the seed oils, have a lot of omega-6s, which make them more inflammatory. It's more the volume that's being used because people are eating pastries and bars, and it's used as a preservative. It's in breads. And so there's so much more than there ever used to be. If you say, how much would be used in, cooking with animal fat. So if you probably used the same amount, hard to tell how it would work out. But nevertheless, there was a study looking at the incidence of cardiovascular disease and all-cause mortality, animal fat versus plant fat over a 24-year period. It was a retrospective study, 407,530 people. There were 190,000 deaths during that time, and overall there was a lower overall mortality and cardiovascular mortality when people consumed more oils from plant sources, particularly grain oils, oils from grains, and vegetable oils. Oils that people don't think about from an animal source besides animal fat is also the fats found in eggs and dairy, which contribute a lot to the overall fat intake of an individual diet, especially saturated fat. And saturated fat not only can be converted to cholesterol, but again, it's increased oxidative, increased inflammation. So we know that choline from eggs can be used to convert to being inflammatory compounds that affect the vasculature. So please don't feel the pressure to revert back to animal fats as a protective source. And the study found that if people replace 5% of their calories from animal fat to plant fat, and particularly those from grains and vegetable oils, there could be a mortality reduction as much as 4 to 24% overall, and 5 to 30% cardiovascular mortality. So again, very much worthwhile. So last week I had Nathan Meinerich on the podcast, and we talked about the programs that we're launching in the practice, but you don't have to be a member of the practice to actually benefit from Nathan's programs. He is going to provide those through our website to anyone. You don't have to be a member of the practice to purchase one of those. But there was a study looking at resistance and cardiac function in older women, and it was a randomized controlled trial, 24 weeks of resistant training, looking at cardiac function in older women, median age of, there were 73 women, 38 in the group, and then 35 in the control session. They did 24 weeks of strength training, 3 sessions per week, because, again, as Nathan talked about, 3 ultimately is what we're looking for. They did 8 exercises that involved the whole body, 3 sets of 8 to 12 reps in each of those, and then they did various cardiac echocardiography measurements to look at cardiac function, heart size, ejection fraction of the heart, the amount of blood that the heart squeezed with each beat. They looked at strength, and they measured that with 1 rep max. So the maximum amount of weight you could lift with 1 rep of a particular exercise. And what they found was that over the 24-week period, people did get stronger, and they actually had improved cardiac volumes and cardiac function. So another reason to add strength training into your program. And like I was saying, we're going to offer, and it's on our website if you go to drdulaney.com, or you can email us, 3 different programs at this point. You can fill out a questionnaire and then get a program tailored to your questionnaire for a 2-month program, or you can have a one-time phone consultation with Nathan and then get a program, and then have a follow-up email during weekly follow-up emails or text, or you can get a phone call and just a program. So a phone call consultation first, just followed by a program. So if you have any interest, please go to drdulaney.com or email myself, Jami at Dr. Dulaney, or info@drdulaney.com to find out more about how you can join those programs. We'd love to have you increase your strength and cardiac function. I think it's very important to practice what we preach. We eat plant-based at Jami Dulaney, plant-based wellness practice, and we move. And again, it can be tailored to what you have. Programs can be tailored to what you have in your home or if you go to a gym. But we like to individualize therapies for people. And our goal in the practice is really the goal of the patient, a goal of the member, what they would like to achieve, both from a health standpoint or a strength standpoint or a endurance standpoint or nutrition standpoint, or just general medical care. I think protocols can be guidelines, but unfortunately those guidelines are almost solely interventions and or pharmaceuticals. And I think we can treat the root cause by looking at nutrition and movement and really move the needle so that we can get people off of their medications and into a more healthy lifestyle that doesn't have the side effects associated with those things. So, I'm available to my patients 24/7. They have my phone number, they have my email, they can text me. We have a full-time registered dietitian with Addie Dulaney Minard so that she can consult as people want to help them. But there are also people in our practice that just want to run medical conditions by us, to choose therapies, what's the right therapy for them. We act as more of a consultative practice that way, or again, to provide people with tailored medical therapies. So if you're not happy with the medical practice or you want a second opinion, that's when you go over to drdulaney.com and check things out. Thank you, Sophie, for the vote of confidence. My podcast hosting site is now allowing for some live streaming events. So I think that will be our next step in the future, to have a separate extra, perhaps question and answer session for members or for people that would like to participate in a Patreon type event. And we'll have a live streaming Q&A maybe to start with. So I'll keep you abreast of those things as they come up. Thank you as always for listening to the podcast. I appreciate each and every one of you. Go over to drdulaney.com to check things out. Otherwise, we'll keep everything posted. Follow us on Facebook. Share it with your friends. Pet your German Shepherd. Thanks for listening. Talk to you next week.